My name is Sami. I'm a restorative dentist located in Southern California and the owner of a dental educational channel called Smile Influencers. One tooth has a broken front tooth, another tooth has a cavity underneath an old crown, and the third tooth has a broken filling, and they all need to be fixed. This case shows a broken tooth on a mannequin. Here I'm using a thin diamond burr that I use to create a 45-degree bevel onto the tooth's surface. The white stuff you see here is Teflon tape that I apply to the adjacent teeth in order to protect the adjacent teeth from the chemicals that I'm about to use. The blue stuff that I'm using is phosphoric acid etchant, which essentially prepares the tooth for bonding. I make sure to wash off the etchant thoroughly in order to decrease the likelihood of post-operative sensitivity. The clear stuff that I'm applying is a bonding agent that I apply to the prepared tooth surface and a little bit beyond. I am curing the tooth with an LED curing light, which essentially polymerizes any light-cured resin-based composites. The blue putty that you see here is a hydrophilic VPS impression material. It is a guide that helps us in many cases. Here you can see us using composite resin packed in incremental layers to replace that missing tooth structure and hopefully create a filling that is very strong. And a lot of these have different colors that allow us to pick a shade that closely matches our patient's teeth. We also have different composite resins that have different translucency properties, different opaque properties, and this allows us to create a filling that looks as natural as possible. In this particular case, since it's on a typodont, we're just using one shade to give you an example of how to build up that missing tooth structure. After I use a series of discs that go from coarse to fine to polish the filling to make sure there's no ledges and make sure that it's as smooth as possible. Now, when patients break their teeth, it can be due to a variety of causes. Trauma, let's say you get into a fight and someone punches you, falling down onto a hard surface like concrete. Anytime you put a strong force onto your front teeth, you can put it in jeopardy. This tooth has a crown with an access hole in the middle of it, and there is a large cavity that's developing underneath that hole. Crowns are very strong, and they're typically bonded onto the tooth. And one of the safest ways to remove a crown is by using a little bit of leverage to take the crown off. I use a variety of large diamond burrs in order to clean the majority of the tooth cavity. And at the very end, I use a round carbide burr that runs at a slower speed in order to get the very last bits of the cavity. Bonding agent is then used. We use a micro brush to apply the bonding agent onto the tooth. Core paste is a composite resin system that has a high compressive strength, and it replaces a lot of the lost tooth structure. And we use an LED curing light to cure the outermost layer of the core paste, although it will also naturally harden over time. Here we are fabricating an acrylic temporary crown. We use temporary cement called temp bond to place our temporary crown onto the tooth. This essentially maintains the space until our lab technician finishes fabricating a new dental crown. Typically, cavities form from poor oral hygiene, maybe not brushing or flossing the right way, or having a diet that's high in sugar. This tooth has a broken filling with a large cavity developing between the filling and their natural tooth. In order to clean the decay out, I first have to remove the existing filling, and in this particular case, I'm using a diamond burr to remove all of the old composite resin. After that's removed, I use a round carbide burr that's used on a slower speed to make sure that I remove any infected dentin or areas where there is a cavity present until we have nice, healthy tooth structure. In this particular case, I'm using a bonding agent called Clearfill SE Bond. The primer and bond essentially prepare the tooth surface for the application of our composite resin filling material in order for the filling material to successfully adhere. This is called flowable resin. It's less viscous compared to other resins, but it does a great job at sealing margins and preventing post-operative sensitivity. Packable composite resins are highly viscous resins that contain a high volume of filler particles, which gives them a stiff consistency. At the very end, we are adjusting the shape of the filling in order to make the occlusion of the patient feel as natural as possible. We're hoping that when our patient moves left and right, front and back, that there is no interference between the patient's motions and the new filling that's in place. I always tell my patients that there are things that you can do to protect your teeth, like brushing and flossing in the morning and at night. Avoid dangerous habits like opening packages with your teeth, because although our teeth are very strong, they can break, and we want to be very careful and conscientious about what we put in our mouth.